Good morning, everybody. Thanks for coming. Thanks for joining us today for this webinar. We've got quite a bit of content to get through. We're 60 days out from World Patient Safety Day, so we don't have any time to lose. We are just going to move forward with our planning to date and request for help and a lot of encouragement to come to this exciting event. Now I've got to figure out how to move my slides. There we go. So here's our agenda for today. We're going to do a quick overview of the entire event because there's been a lot of moving pieces, and there's different pieces that are funded by different groups. So we've got to kind of keep that in mind. We're going to share with you our Hill Visit strategy today for the Hill Visit Day, which is going to be September 16th. We're planning a leadership briefing that is still quite a bit in flux, but I'll bring you up to date with what we know so far. We have an interesting and I think innovative approach to fundraising. It's really scholarships to bring people to this event that can't afford otherwise to come. So we're looking forward to that, to sharing that with you and asking for your help there for giving us leads to go to people for scholarship dollars. And then we'll walk you through some logistics and wrap up. But we'll do all of this in an hour. And the people presenting with me today are going to be Sujin June, Beth Daly-Ullum, and Leslie Tucker, all of whom are here. So we've got our presentation team, and thank you very much. Okay. Now it's not letting me. There we go. Okay. So here is our schedule. Just for those of you who have been following it, we've gotten several requests. So we are going to have a welcome reception on Sunday, September 15th, from 5 to 6 at the Johns Hopkins facility that is basically hosting most of our events this year. It'll also be the time when Project Pivot kicks off with a dinner after our reception. So everybody is welcome to come to the reception. The next day, we're going to move into kind of two strands of work. One is the Project Pivot workshop, which is funded by PCORI. PCORI doesn't fund advocacy. I just want to make that point really clear. So we've had to really some of our events are advocacy events, but we've had to keep things somewhat distinct to make sure that we're living up to our funding commitments. Those that are not doing the Project Pivot workshop will be doing Hill Visits that Leslie Tucker, Beth, and I have been working hard to organize over the last couple of weeks. So we'll be doing that. Those two things go on all day. And then in the evening, we have a film premiere of a new documentary on patient safety with a real AI focus. And we're co-hosting that with Academy of Health. All of these activities happen at the Johns Hopkins conference facility, which is right next to Capitol Hill. And Tuesday, which is actually World Patient Safety Day, we will do our march. It's scheduled to kick off at Freedom Plaza at 10:30. We'll march to a very nice part of the Capitol lawn. And then we'll do a remembrance ceremony there where we will remember people who have been harmed or who have lost their lives to medical error. And we'll be happy to have, Sujin is going to talk about this a little bit more in just a minute. And then we'll finish up the remembrance ceremony, or when that concludes, we will move back to Johns Hopkins for a leadership briefing. And we'll tell you about who we've invited and the status of that as we move forward with this schedule today. Okay, so here is our facility. Johns Hopkins has been a fantastic partner. They have basically made this facility open for at very little cost to us. We might have to pay for security depending on who comes, but otherwise we couldn't have asked for a more generous or more participatory partner. I mean, they've just stepped up at every stage. So we're very, very grateful to them. It's a beautiful facility. It's between where we start the march and the Capitol. It's very, very close. So we're fortunate to have something that is so geographically compact. For those of you who know DC, it can take a long time to get across town. We're not going to have to worry about that. And there's just a couple of pictures of that sort of beautiful facility. One of the things I just want to mention is that talking to them, they want to make this available to groups like us, who really are pushing forward in making the kind of change that we've been waiting for a long time. So they're enthusiastic. They're with us, not just in terms of logistics, but in terms of our spirit and mission as well. So Jenny, you're going to cover our flag and remembrance ceremony.
Yes. So this was one of the highlights of our event last year. So we're going to continue this ceremony this year. We'll be collecting names to be honored during the ceremony, and basically we'll put the names on the flags that you can see in the picture and plant them next to the Capitol Hill, and we'll do a ceremonial, if you would call it prayer or but some type of ceremony together to really remember those harmed through medical error. Um, and many people felt many people who participated in the ceremony felt um, it was very emotional and impactful, just remembering together with others. So I'm going to encourage people to share our link and form, and if they cannot even attend in person, the names can still be shared with us, and we'll make sure to honor their names in our ceremony. And you can use the link that's showing on the slide to get to the form, and in that form there should be line where you can put the names in.
Thank you, Sujin. I'll just add that we've been doing this march since 2020, and our numbers have been small. We started in the middle of the pandemic, even when no one else was traveling. We came and did this, and we've used this ceremony to just say things about the people that we've lost or that we have been harmed. So I'm hoping our goal is to increase the number of flags. Our previous goals have been 200. Now we want more. So we will tailor the ceremony to the time we've got, but it really has been a place for us to say something about the people that are no longer with us that should be still. So it's been very, very meaningful to me as well. Okay, this is just a pitch and a link to the trailer for the movie that we're looking at. This is we have a lot of competing events in DC over this couple of days. And we've reached out to the organizations that are scheduling other things. You'll hear more about that later, but one of them is Academy Health. They have a big conference that day. And again, in the spirit of partnership, they just said, what can we do together? What can we find that's additive that we can do together? And it is this film premiere. So we'll be co-hosting this at the Johns Hopkins facility. There's a beautiful theater there. And it was also helped one of the producers that produced it, I think actually the only producer, was the Jewish Healthcare Foundation. They funded a big part of this. So they're a partner in this as well. And they've been a partner with us for the march in years past. So I'm excited to see this. I've actually seen the trailer and I can't wait to see it again, or the whole movie. Okay, we're going to move. That's our overview. And before I kind of turn this over to Beth to talk about our Hill visits, I do want to just thank all the people who have rolled up their sleeves and put a lot of time into planning this. I wish we were a little bit further ahead of schedule. It's sort of the beauty and the challenge of a coalition is when you've got so many voices and so many volunteers, it takes longer to get to certain points. But there have been so many people that have that have contributed to this effort, and I know I speak for all of us in saying that it's just a beautiful thing to be part of and to watch. So on that positive note, Beth, I'm going to turn this over. Oh, no, I'm going to do this. I'm going to do the state of patient safety, and then I'll turn it over to Beth to talk about Hill visits. So in terms of our messaging for the Hill, we've spent a lot of time thinking about the messaging we're going to ask for and the case that we want to make about where we are now. So we are 25 years after the To Err Is Human report that called out patient safety as a public health initiative. We've seen it prioritized. We've seen that drift. We've seen progress made and lost. We have a whole lot of best practices that have been pulled together, many of them in the patient safety structural measure that is currently pending with CMS, but a lot of those best practices just aren't being used. They're sitting on the shelf. They're used by some providers, but not all. We appreciate the ones who do it. I think every healthcare facility should be using that as base standards. We continue to have an underreporting issue, and this will be one of our major messages that Beth is going to talk to us a little bit about. You can't do safety if you don't have the data and the reports and the events to go into the machine that produces solutions. So it's a major challenge for us 25 years into a movement that we still see underreporting. and sometimes actively hiding harm, which is just unconscionable, frankly. We also see just a lot of resistance to oversight, accountability, and transparency, even though those are, again, just sort of the gist of system safety. They're the fundamentals of system safety, that unless you have those things, you don't have safe systems, the safe systems that we all deserve. When I talk about hiding, we over rely on whistleblowers, and we shouldn't be in that situation in, 2024. Every year or so, there is some person in an organization, typically, or sometimes a patient, that steps up and just brings something to media that isn't reported. And I'm not talking about people here really, doing the wrong thing in organizations or making mistakes. I'm talking about the organizational responses when they have a learning event that happens in their own organization and they don't report it. It just is something we have to call out, I think, as a major impediment to the progress that we hope to be making by now. These are just some of the stories that have happened in recent years. And, I don't mean to embarrass any of these organizations really, but calling out the leaders. I mean, these are trusted organizations that we need to be able to rely on. In terms of the scope of harm, we still don't have good surveillance from a public health point of view. We rely on studies. That's not ideal, but the studies show a pretty daunting picture. We have 25% to 30% of patients in all healthcare settings experiencing harm events. And that goes from hospitals to nursing homes to rehab centers, I mean, across the board. A lot of this data comes from the OIG, but there's other major studies that have been produced in the last couple of years that sort of confirm the same numbers that OIG is finding in its surveillance of Medicare patients. Diagnostic safety has really emerged as a huge new bolus of preventable harm. We've often talked about how medication safety is the most frequent harm. I'm not sure that's true anymore. It might be diagnostic safety, diagnostic delay, diagnostic misdiagnoses, or ones that are effectively made, but just not effectively communicated to providers or to patients. I mean, we see all of those lapses in diagnostic safety, and we're again relying on estimates because there's almost no reporting of this that comes through incident reporting systems. We also have an old and ugly problem. It's entrenched bias and outcomes disparity. This is something that has just been part of our healthcare system for as long as we've been measuring it. Certain populations routinely, statistically get worse outcomes, and they're often vulnerable populations. The ones that we're really focusing on in Project Pivot, which I haven't said too much about yet today, but I think you've heard a lot about Project Pivot, is Black and brown mothers and babies, persons with disabilities, and older persons. And then we also see it across a number of different populations that are frankly at risk for either embedded bias or active discrimination. And then we just see, again, this huge variation from setting to setting. We see some organizations really stepping up and making safety a priority, and then we see others that are insisting on that everything be voluntary, and that's just not acceptable anymore. The safety, making progress, making solutions depends on us, again, flushing out the harm, seeing the harm and doing something about it. We have a PSO program, and that was supposed to be our PSO stands for Patient Safety Organization. Some of you may not know what that is, but it's a law that was passed in 2005 that created organizations. It enabled organizations to be created that would look at patient safety events, look at analyses, and contribute to a nationwide learning system. And the reporting from the different PSOs, there are more than 90, to the federal PSO, which is called the Network of Patient Safety Databases. It's at HRQ. Of the 90 plus PSOs, no more than a handful report because the reporting was left voluntary. So those PSOs essentially become silos. When we look at outcomes data, we can't see that they're having any impact. And another thing that I think it's really important for us to emphasize is that we don't have the ability to report to these places ourselves. So we could report things that don't come through the incident reporting systems or the PSO systems, and that will be especially important as we look at diagnostic safety and the bolus of harm that's doing that. So talking about pathways for patients to report is going to be an important part of what we seek. And then just this hiding of harm, this defensiveness that we continue to see, again, 25 years at least. Michael would say Michael Millicent is with us today. It's longer than that, 30 years, 35, of the call for transparency. The anesthesiologists have been doing it for at least that long. If we can't see the harm, we can't prevent it. We can't learn from it. If we hide the harm and you get paid for it, that is fraud. That is government paying for care that shouldn't be paid for. And there's no financial consequences at all for that. So calling that out, pointing that out, that we are all kind of paying for care that's bad, and the hiding is intentional. When that happens, it's intentional. That's just not right. And we really stand aside apart from other industries that manage the risk of human injury, where there's much more consistent and even-handed reporting and consequences for not reporting. So this is not just us talking as patients and families. I think we bring the urgency to this situation, but this is also backed up by think tanks. The National Academy of Sciences looked at that PSO law from 2005. Built into that law was a 15-year look back. And they basically said, it's not working. We're at a relative standstill in patient safety in this country. We have not achieved the level of safety that other industries have been able to accomplish, because they, again, have more transparency, more reporting. We also have a major report from that's sitting on President Biden's desk. I should say that, but maybe not his personal desk, but it's at the White House, from a prestigious group of scientists that made recommendations for there to be a transformative approach to patient safety. Sue Sheridan, one of our co-founders who's here with us today, was on this working group for this. It's been sitting there for a long time. We've wondered whether it's going to be, whether it's going anywhere. But there's some new news that we'll share in a bit about the fact that there may be another event on the 17th of September around this report. So we wanted to reacquaint you with it as something that is a factor, frankly, in our environment right now that we may be talking about on the 17th. And then this is my last slide, and then I'll turn it over to Beth. And actually, Beth created this slide, so it's a good transition point. But here's our status quo. We're in a situation 25 years after To Err Is Human, where we still see these devastating injuries happening to patients and devastating impact also on their families. We have entrenched inequity. We have fractured and siloed data, not enough patient engagement, certainly in the reporting. I mean, that's a huge area of potential for us. There's no consequences for hiding harm. We see the organizations doing it over and over again, and there's no consequences. So that's not the right message to send. And then, when government pays for care and it's bad, that's costly to taxpayers. Taxpayers pick up the bill. So the fraud there is picked up by taxpayers. So Beth, I hope I've kind of not stolen your thunder, but given you some things to really build on as you move forward here.
All right, thanks, Marty. Can you hear me okay, Marty?
Yep, we can hear you fine.
Right. And I'm going to apologize. I'm not in my normal office. I had surgery yesterday, so my video is probably in a weird background and everything. So advocacy goals. This is where we really need help, because we're going to have this Hill Day that Marty talked about, where we're going to go around and lobby the key members of committees and, talk to them about patient safety. And we have three overarching goals. Is one, do they understand what patient safety means? Raising awareness of general safety issues, especially of diagnostic safety, as persistent problems with really inequitable impact and costly problems. A lot of them just don't understand how that costs taxpayer dollars as well. So that plays to both sides of the aisle. Then we're going to come with a specific list of areas of improvement that we'd like them to consider around federal policy, budget, and oversight. We'll talk about those today at a high level, but for the smaller group that signs up to do the Hill visits, we're going to have additional very in-depth prep sessions and handouts that they're going to leave behind at the Hill visits. And then the third goal is just to build a network of supporters, people who understand safety, are excited about it, committed to it, and can work with us for ongoing legislative changes or executive agency pressure to change some of the things that aren't working. Marty, I can't move the slides forward if you want to move. There we go. So the four general areas of asks that we're going to call them asks in our legislative visits will be around see the harm, because one of the biggest challenges is patients can't report it, like Marty talked about, and then this normalized non-reporting of harm. So if we don't actually have visibility into the scope, we don't have visibility in the cost, we don't have visibility in how to fix it. So really getting more significant consequences, not necessarily for the harm happening, but for the hiding of harm. And really the hiding is where we've had such just lack of progress. So talking to them about creating ways to pressure and have real consequences for those who hide harm and are really impediments to improvement. Secondly, the access of patients to be able to be included require telling patients about the harm that happens to them. And if they aren't told, having patients, if they recognize harm, be able to direct report into the various government sources so that there's kind of a check and balance in the reporting of harm and helping create more visibility in the harm. The third piece is really getting to this stop paying for harm. And around this, I think one of the things that we've really thought more deeply about is that almost it should be, if you report the harm, there should be more leeway. But if you're hiding the harm, that's where needs to be a very significant consequence. We also have some specific requests about greater visibility on a facility level as opposed to an aggregated institution level. A lot of times you get big conglomerate healthcare organizations and they roll up all their harm into one number, right? And we want that broken down so that you get greater visibility. And so then when the patients report, they can link it to that individual facility and create greater attention to individual facilities. So that would all be linked into both the seeing the harm and the don't paying for harm. And then there's some specific law loopholes that exist that really just are impediments to improvement. And we'll be asking for some revisions in those areas or consideration of revisions in those areas. So those are 4 areas. And so this is really where we need you, because we need commitment of people to sign up, because we have to create these little teams or pods of people and match them with the committees that oversee the different parts of healthcare rules, regulations, agencies, so on and so forth. So if we don't know who's going to sign up and come with us on Hill Day, and it's totally fine if you've never been to the Capitol before, it's fine if you've, never lobbied before or never done an advocacy day before, because we're going to create these paired pod teams of, prepping everyone in advance and having people get comfortable doing it as a group. You won't be sent off on your own, but we really just need people to sign up and commit so that we can create probably 5 teams of 2 or 3 people. Is that helpful, Marty?
Yep.
And then I think I'm going to hand it off to Leslie here, where we're going to talk about the committees and how we pick who to visit.
Yep. Great.
Great.
Hi, Leslie.
Hi.
And I did the yellow brick road because I thought that was a good analogy here, Leslie.
That was very nice.
So, because there's a lot of people in Congress and we, how do we pick who to visit? This is what Leslie does for a living.
Oh gosh, right. And I super want to underscore what Beth just said. If you've never done this before, think of this as a really fun opportunity. You will have experienced people as both prep and guides on that day. It's actually very satisfying. So feel secure in that and know that, yes, we really do need you. So there, as Beth said, are a number of committees and subcommittees in both the Senate and House that have oversight jurisdiction of various pieces of the healthcare policy puzzle. And we're going to go through those right now with a little bit of a pause on each slide, because what we've done is to indicate not only members, but the states and the districts that they hail from. And I'm hoping that everybody on this call will recognize themselves in at least 1 or 2 of those offices, and their appetite will be whetted to come in and help make a difference there. Similarly, if you have friends or families in those districts, we would welcome that kind of participation. So in terms, if you're not exactly sure which congressional district you're in or who your member is, there is a link right there, congress.gov/members, find yours. Make a note of it. It's super simple. And then we will ask that once you have more or less committed yourself to coming and participating in that day, send me an email. There's my email on the screen, and I will help you if you need it to request a meeting for that day. Each office has a generally similar process, but they vary a little bit in their technical details. So I am more than happy to facilitate and make it as smooth and easy as possible. So in general, on the Senate side, there are 3 committees. The appropriations committees, as you probably know, are the committees that actually put money in the various buckets that the other committees say would be a good idea to fund. And then the authorizing committees are the Senate Committee on Health, Education, Labor, and Pensions, otherwise known as the HELP Committee, and the Committee on Finance, which has the lion's share of jurisdiction over anything related to Medicare. So on the Appropriations Committee, here is that slide that I mentioned. You see the states. To be honest, we always struggle to find people in red states, and that is often because of the way, frankly, that academic medical centers and other locuses of activism distribute across the country. So we're especially prizing people who can, who would like to establish relationships with their senators in red states. Everybody's welcome, but I'll just let you know that's a particular challenge.
Okay. Next, okay.
I think next. Here is the Senate Health Committee. The same applies here. So for example, a very important person on both the Health Committee and Finance is Senator Cassidy from Louisiana. We know 1 or 2 people in Louisiana, not sure they're going to be with us that day. So there are these key states who become really important on these committees. And, you know, one of our main talking points is medical error, diagnostic error, medical error is likely to affect all of us at some point in our lives in a significant way. There is not a more nonpartisan issue out there. And so next group. Here we are again. Again, you see a lot of Republicans from these really rural states, and the Democrats tend to be bi-coastal and Pacific and Midwest. So
Les, just to clarify, should people look and see if their state is listed and then email you if they would be willing to come on the Hill Day and reach out to their state senator?
Thanks for clarifying that, Beth. But yes, absolutely. That's why we're going slowly through these slides.
So,
next.
Okay, good. Leslie, I've got a question. If we like Angie Craig, who I think is coming up on one of these slides, is the congressperson for us. I'm not from Minnesota. I'm from Minnesota. I don't live there now, but she's a congressperson for my brother's. She's his congressperson. Could I do a visit with her and just kind of, and I've fundraised for her. I've actually donated to her campaign. So could I ask for a meeting for someone like her who I've supported, even though I'm not her constituent?
Absolutely.
Okay, good.
Absolutely.
Okay, Senate, anything more here, or should we move on to the House?
Let's move on. So 4 committees in the House side, analogous to their Senate counterparts. There is the Health and Human Services Appropriations Subcommittee. Ways and Means Subcommittee on Health, again, has a lot of jurisdiction over the hospital part of Medicare, Part A of Medicare. The Energy and Commerce Committee does a lot of public health stuff, plus some Part B of Medicare, physician services. And then the House Budget Committee, it's a little late in the year to be meeting with the Budget Committee, and we don't know what the elections are going to mean in terms of next year's lineup of people. But this is just as a matter of good practice, a stop we always want to make. Again, here, please take a look at this list, look at the states, see if you see yourself or know another advocate who calls any of these places home.
Okay.
Please reach out to them. Give, and
Leslie,
Yes.
this is Sue. Can I ask a quick question? Now, we were talking about Mike Crapo from Idaho. I thought he was a ranking member of the finance committee. He's a ranking member of something. You and I talked about him because one of our champions, I don't see him out there, but maybe I'm wrong. I thought Mike Crapo was kind of one of our targets in Idaho. We don't have many here. I saw Mike Simpson on the other slide.
yeah,
I thought Crapo was a ranking member in,
I'm gonna have to go back and look, Sue.
yeah, I could be
I will
mixed
do
up,
that.
but yeah, and I can also look, yeah.
So I pulled all these off just straight off their website. So it could be he's
Okay.
ranking member on another committee, but I
Yeah, it
went
could be.
to the committees and just pulled the names kind of painfully off the website. Just like,
A lot of work that went into these slides.
it's really annoying.
Wise. Again, here we are with Ways and Means. Have a look.
Okay.
Energy and Commerce Subcommittee, a big and very popular committee. Interestingly, we have several physicians on this committee, which is great. And the trick there is that they are everybody's favorite target for asks like ours. But I would point out, for example, that Kim Schreier, Democrat from Washington, has been quite a good champion for diagnostic safety and quality, for example. And Michael Burgess on the Republican side, although he's about to retire, has also been willing to step forward and try to recruit others in his party to participate in some patient safety legislation.
Yeah. Okay, great.
The only thing I might add here is that it feels a little intimidating to reach out to these people. You know, you think of like big pharma and you know, med tech probably have 50 people and spend millions of dollars in lobbying efforts. But I think in a way, because we're doing this all ourselves and we're people who have been directly impacted by safety, and this is our life and what we care about, I think they listen to us differently, and it's very meaningful. So we're not.
It's very meaningful, and I will tell you, based on my experience doing this, if you ask a staffer, have you heard of this issue as a policy issue? Many will say no, right? Their heads are stuck in Medicare reimbursement policy most of the time. So patient safety, what can we do about that? But the minute that you click in and you say, do you know somebody who suffered a misdiagnosis and significant harm from it, or who was otherwise harmed in healthcare, every single one of them will be able to click into a story. And that's between sharing your story and eliciting theirs. There's magic that happens in that moment. And you have their attention and their empathy. So thank you, Beth.
And I want to respond to Kai's comment in the chat, because even if someone's retiring and we don't know who will replace them on the committee, you know, sometimes even meeting like John Sarbanes, you know, that would be a great meeting for us, because he could say, okay, I'm retiring, but let me reach out to these 3 other people and make sure you're plugged in with them. So it's not necessarily just that like Sarbanes might be out, but he's been there so long and has such a good network that he can make sure we're plugged into the right staffers as a follow-up.
And Beth, I think we should also say that, you know, these meetings, you know, it's an election year. These people might be out campaigning, but even meeting with their staff is
staff is
very important. And, you know, the staff of retiring people tend to end up elsewhere. So staff education is a hugely important part of what we need to do here. I mean, in many ways, they run what gets teed up and what doesn't. So this is great.
I've had a relationship with Tammy Ball.
Great.
Good.
She's wonderful.
And met with her over Bakori. So and when Bakori was up for to continue the research in healthcare, and met with her. So that, you know, I'm definitely the Wisconsin Senators anyway, because I know that building I can get into. I'm not sure I can get into the representative building always.
Okay, I think you can. We'll help you.
But yeah,
Yeah.
I think so. Yeah, I don't know how close things are there. Will I be able to? Do I need to set up vans, or do I?
Rosie, I don't know if everyone knows that you're a wheelchair user. So we're talking about how we move people, even though we're sort of geographically close. Our hotel is a half a mile from here, so we'll figure out the transportation needs for everyone, including people who have wheelchairs, rely on wheelchairs.
I'll be on.
That is a
I'll be in a
nightmare.
scooter. I'll be in a scooter, Rosie, so we can figure it out together.
Yeah, well, I have to have a wheelchair accessible van because I have a power wheelchair.
Yeah, we know.
And so that's an interesting world.
Yeah.
And DC is not always friendly.
Yeah. I know that, and it's one of the reasons why I just think it's lucky that we have kind of this geographic proximity that's close, because it'll give us at least the possibility to make it happen, Rosie.
Yeah,
but
yeah.
there are,
So you're saying the hotel's about a half
mile.
Half mile? Oh,
Yeah.
okay.
But we'll worry about the transportation stuff. You can leave that to us. We'll worry about that. We'll make it happen.
Okay.
So what are the to-dos on our timeline here, Marty? For right now, what do we need?
We need people to register to come. So there's a registration site at our website. We've got Leslie teed up to help with getting visits. I've always found that getting visits is easier than we think it is, because it's an election year. I mean, they care about their constituents. You know, it's easier than you think. There's people, they've got staff dedicated to taking care of constituents. And then, so register at our website, and then, you know, in that registration process, you're going to be prompted to ask with a number of questions, including, do you want to have a flag planted? Do you want to do the hill visits? We need to get some commitments so we can start organizing the meetings and get organized on our end. And then in July and August, the rest of July and August, you know, start making your travel plans. Please come. We would love to grow the numbers of this event this year, especially because it's such a consequential year. And then, as Beth mentioned, we're going to be doing a lot of training for the people who sign up for the hill visits, a lot of orientation, a lot of training. So you will not go into this with not prepared. We'll meet by webinar at least once, probably a couple of times in September or late August or August. And then we'll gather right before we go up to the hill too. Beth talked about the organization of the teams. That is going to be, you know, it'll be in flux up till the very end. I'll tell you that, because the meetings will be coming in throughout this process, but we'll get organized the night before the morning. For those of you who did this last year, you know, we made it work. And I did hear from Johns Hopkins today that we can use their building as a meeting place if we want to. So they'll let us convene there, and it's very, very close to the Capitol buildings that we'll be visiting.
Okay.
Marty, this is Adam. Can I just make two brief observations?
Sure.
Okay. In reverse order, in terms of what Beth and Leslie were talking about, who to target, I know you're going to get more specific about this, but since the House is controlled by the Republicans, you might want to think about putting more of the weight on Republicans in the House and Democrats in the Senate. I know that could shift. You don't want to leave anybody out. The second is this one of the asks, the second one, include me. I'm wondering if that can be strengthened, because, you know, it should be like partner with us, or put us in charge. I mean, the idea of engaging can be slippery. If you say include me, then it's the option. of the person who's including the other party, and I'm not sure that's strong enough for the message that you want here.
Okay. Thank you, Adam. You know, we will be working on this messaging tone as well as strength. I mean, we just gave you the 10,000 or 5,000 version today, but that this feedback is important. We'll be asking for that as we see who's coming and define our messaging. And it'll also change a little bit from person to person. And as we go to the different sides of the aisle, we're going to be sort of tailoring our points to what we know those people are interested in, the different offices are interested in. But thank you,
Yeah.
Adam.
Let me just clarify. I mean, when you say include me, I'm not sure who you mean either in that formulation. You know,
Include patients and families.
Okay, I know, but okay, but okay.
Yeah.
Why don't we table that, because we've got a bunch more to go through, but I totally appreciate the point that include me might not be strong enough. And you know, there's the idea of throwing out a partner with me. We can ideate, but really what we want is patient reporting and a standard for patient reporting and patient disclosure. So I hear you. We'll make it stronger. Point. We got it.
Okay.
Thanks, Adam.
Yeah. So here's where we are on the leadership briefing, and we are distinguishing this from our advocacy activities. This is an opportunity for us to hear from government leaders about what they are doing. If many government leaders can't participate in advocacy events, so we're really positioning this as a briefing, not an advocacy event. We'll be able to ask them questions. We'll be able to make our advocacy points, but we want them to come. We want them to tell us things that may not be public about what's happening and what they're involved in. The person
Marty,
we've invited.
what's the leadership briefing again? We should have put the date and time on this.
Oh, the leadership briefing will be after our march, after our remembrance ceremony. We will go to Johns Hopkins. There'll be food there, and we will start a 2-hour leadership briefing starting at 2 p.m. on the 17th. So it is World Patient Safety Day. It'll conclude at 4. That should give most people who are flying in a chance to get home. Unless you've got a tough connection, you should be able to get a flight out from DC that night.
So the Hill visit is Monday, the march and leadership briefing are Tuesday.
That's right. And the remembrance ceremony.
And remembrance, sorry.
All in sequence and all pretty close geographically.
Check.
Okay, so far, and this, I have to just say that this is in flux as we speak. We've invited Secretary Becerra to come and talk to us at this group. He's talked to leaders of organizations. He's talked to board members. We've positioned this as, here's an opportunity to talk to a very diverse group of patients and families that are going to be coming together, because we already know we've got a very diverse group coming for Project Pivot that are already confirmed. And then we will bring some more geographic diversity and other kinds of diversity to the people who sign up for the Hill visits too. So we've made that pitch. We're in conversation with their office. They actually came back to us on Monday and said, we're planning an event of our own. We are not sure it's going to be on the 17th, but it may be. We'd like to coordinate so we don't step on your event. And their event is going to be at the White House. And I asked, is it going to be about PCAST, that presidential report that I mentioned? And the answer was a qualified yes. So there's that variable out there that we are still in discussion about. I think there's a will on both sides to connect the events. The connection might be virtual, because if there is a White House event, they will not invite us all to the White House. But we had a good discussion as a backup of us connecting our events virtually. And Johns Hopkins, I talked to them this morning, they're able to do that. We've got other sort of softer invitations that have gone out to CMS, CDC, and the Veterans Health Administration. They're interested in presenting. We haven't issued formal invitations, but we know that they're planning to come and to present. And we'll go for, I think, very senior people in those organizations. That's who we're talking to. And then the other thing that I know we can say is that we're going to be offering maintenance credit. There won't be CEUs for those that need them, but if you're one of these certified professionals, there will be maintenance credit that you can get for attending this 2-hour meeting. And again, it's an opportunity for us to hear from our executive leaders in particular about what they're doing on the theme of patient safety, which is diagnostic safety and safety in general. There's also 2 HRQ events that are scheduled that day. There's a Academy Health event. So we're just trying to work constructively with people to make sure that we aren't stepping on each other's toes. And I think that's going well, but it just hasn't landed yet. I did want to just kind of refresh our recollection. This came out of a conversation Leslie and I had yesterday about the PCAST report, because, you know, many of us haven't heard about any progress on it. But it does dovetail, if it is still in play, and if there is going to be a White House event, these are the top line recommendations. Coordinate federally around patient safety, ensure that that all patients receive care, engage patients in reducing harm and improving equity, and then more research and more use of technology and other things that are coming on the line that could be tools for safety. So we're in the right space in terms of our asks with what might come out in an announcement there. Okay, fundraising. This is something that another sort of working group, it's been Sue Sheridan, Krista Hughes, and I have really kind of worked up with others. But we are going to tailor our fundraising approach to really bringing scholarships in, scholarships that can pay for travel. We've priced these at $2,000 a trip. That should pay for airfare, hotel, and us feeding people who can come. We are going to be, we already have some scholarship money, but not enough to bring in a larger group of people. So this is what Sue, Krista, and I, and anyone else who wants to help over the next month are really going to be doing, and that is trying to bring in dollars for these events. We kind of moved away from, you know, tiers that would support meals or receptions, with an exception. I mean, Beth has generously agreed to fund our opening reception. So that was nice. Thank you very much, Beth. But for the most part, we want to give organizations, especially industry and large nonprofits that are seeing their reserves do very, very well in the stock market right now, a chance to really help us get people to Washington. So we've priced this pretty high. This is going to be a reach for us. It will be a good experiment for us, but I'm super excited about the ability to just kind of see if companies out there will help us bring people to DC. We know there's going to be a range. I mean, last year we asked for a much smaller amount of money, and people came and said, we don't have a budget for this. Can you take as little as a few $100s? And we said yes. So that other donations categories is there for really nonprofits that don't have a budget for this sort of thing. In terms of scholarships, I mean, you know, this is going to be a moving target. So when we raise money, we have to have some criteria for how we're going to use that. And Adam, I think you asked about this in an email. So we are going to prioritize people with lived experience of unsafe care. Those powerful stories can be really what opens up a conversation on a relationship in DC. No resources to cover travel costs will be another consideration. Key districts and key people we want to meet with, key states will weigh that. And then we'll ask people to stay for the entire event. I mean, we'll weigh that as well. If people just can come in for a piece of it, we would prefer that we spend that money for people who can stay for a couple of days. Okay, and this is something we will be just gunning for, a scholarship fundraising over the next 30 days. Sue and I already have a plan to roll up our sleeves and do this 24/7 moving forward. With other people's help, again, you could help us. So logistics, Holiday Inn is our hotel. We have a block of rooms. Susan Burke, who's kind of been our director of logistics and our project manager here, many of you have met her already, did a great job at looking at hotels in the area. This is new. It's very accessible to anybody. It's close to where we are. It's relatively well priced for DC. And it was a good choice. And thank you so much, Susan, for helping us sort through the options and finding one. There are other hotels around us as well that you're welcome to stay at, but we have a small block here that we can grow depending on who registers at our website. So again, that registration piece is important. This is our hotel. And then you'll see we're thinking about transportation already, Rosie, about how to get people from the hotel to Johns Hopkins and to our parade route. Rosie, I've seen you move around at conferences too. Let me just tell you that the parade route down Pennsylvania Avenue is pretty wheelchair friendly. I mean, it's.
I'm not worried about that.
Okay,
I don't.
good.
Okay.
Okay, next
And
step.
it might not be that bad even going from the hotel to, depending on what it's like from the
Yep.
hotel.
Okay.
You know,
Um,
because we have a power chair. It's not, I mean, it's weather might be the other problem, but
yeah.
I've gotten,
We've done this march in the rain. So if that's there,
I'm with that. I don't find them have a problem with getting wet.
okay. Okay, here's where we need your help. I mean, we need you to register. We need to know who's coming. You know, that helps us get the meetings that we need, that we hope to get. Again, this is a little bit of reinforcement through repetition. Here's the link for looking up your congressional member if you don't know who that is already. Leslie's here to help. Fundraising. Sue and I are your contact people. We have a list of leads that we're going after. If you have companies that you think we could approach for donations as little as 4,000 up to 40,000, we would welcome that. Get the word out. I mean, you all have networks, or many of you have networks of your own. You don't have to be a PFPS US champion to come. If you have networks, you could really help us by getting the word out and seeing if there are other like-minded people who would like to come and be passionate about patient safety and get the conversations that we need to have on the Hill. I mean, this is not a one-off. This is building relationships for the future as well. Adam's mentioned that we could see a lot of turnover in November, but staff tends to stay. So we want to build a relationship with people and educate them about all the stuff that Leslie and Beth talked about. And then just come to DC. I mean, it's 2 months out. I know that's not a lot of lead time, but we can still get decent airfares. They're lower than last year. Please come and be part of this event. For those of you who've done it before, you know, it's just a very, very meaningful way for us to, you know, walk our talk. So Beth, Leslie, others, any other comments as we kind of ramp up here for a couple of busy months?
I found one ARC meeting. I don't know if this is the one you mentioned. I put it in the chat. It's a webinar from the National Alliance about diagnostic excellence on the 17th.
And they're also doing a workshop on HCAPS. So that webinar you've mentioned, Adam, I've talked to HRQ2 about beaming that to us. We may start an hour early if that happens. It's just one of the things that's in flux, but
That's brilliant. I think that's great.
Yeah.
Hey, Marty, can I make a few comments?
Yes.
Regarding fundraising, I mean, we are shooting for kind of the lower end in terms of scholarships of 4,000, but there is an option to contribute less than 4,000.
Yeah.
So I just want you to know that if they say, hey, I can give you 1,000, there is an opportunity to contribute less than 4,000. I think we call it the friends level. So
Yeah.
just FYI about that. And then, Michael, you had a question. I know that some of you on here may have a question about what this overlap between Pivot and
right.
World Patient Safety Day events. And so and again, like Marty, the language he's using, this is in flux, but there is a core set of patient groups that have been invited to Pivot. And then we're also trying to get more individuals who will be at World Patient Safety Day that may want to participate in Pivot. But they may have to peel off to go to the Hill. And so we're really working on that right now to accommodate, you know, what everybody wants to do. And I think that even if you're at Pivot for part-time, there's going to be a lot of opportunity. We're going to be polling, we're going to be prioritizing, we're going to be talking about stories. So we're trying to figure out this overlap. It just gives, you know, just trying to give people the biggest opportunity to participate in all that we're doing.
Sue, is the Pivot team set per Adam's question in the chat?
Oh, I didn't see that.
The last one that Adam just put in.
Okay, I didn't see that. Yeah, the people there, we sent out invitations to the core set that we have funding for of the Pivot patients and partners and organizations who've been kind of with us since we started writing grants because we had to list our partners. So, but what we're really trying to do through scholarships is bring in more people well, that's our plan. Try to bring in more people and fund more people to participate in Pivot.
So Adam, if you want to send Sue an email directly, her email is on this page, and then you guys can be in touch about that.
Yep.
But in the
so much.
meantime, we really need people to sign up for the Hill visits. And Leslie's email is also on this page. So we need a list of people who would be willing to do Hill visits. That's one of our main goals of today. So if, you know, the pivot sign up is kind of separate, so email Sue about that. But if you can email Leslie and say, yes, I'll commit to joining Sunday to Tuesday for the Hill visits. That's really what we're trying to get, is that's the squad for the Hill visits.
And
Um,
okay,
Rosie, you've got your hand up and Ariana has too. So Rosie, you first and then Ariana.
yeah, because I have to leave. I just want to make sure that if I will let Leslie know, but I'm willing to do any Hill visits that need to be done, especially for Wisconsin.
Yeah.
And
Yeah,
Yeah.
if you'll register for the event, there's a question there, will you do Hill visits? And just say yes there, and that'll help us
Okay.
build the database too.
Okay. I
Ariana?
have to go to another meeting. Sorry.
Bye. Ariana?
Yeah, is there, I'm sorry if I missed this, but is there a list of other organizations who are like supporting, not financially, but are partnering with you guys on any pieces of World Patient Safety Day activities? Like I'm just thinking like NQF, or like I see Deanna and Beta on the line, like Sepsis Alliance. Like I'm just trying to think, who have you guys reached out to? Because I'm trying to think of who I know in different regions, and I don't want to double up.
We have reached out to a number of organizations, but it's been a while. So we need to reinforce those invitations, Ariana. And we ask everybody for money, but NQF is a good example. They don't have a big budget for this. They came back and generously gave us something last year. So for organizations that just don't have a budget for this, but have in-kind services to offer, I mean, they marched. They came to the march, several people. We would welcome them as partners, and we'll acknowledge them and recognize them as partners. So,
yeah, it might be helpful if there's like some kind of public list of who is on your radar to share, just so we don't end up sending out like 3 different asks between all the champions or something like that.
yeah. Okay, thank you. That's a good point.
Thanks.
Rather than a public list for now, I'll circulate to people a list of people that we're inviting, so that you can see that now before we publish it, because we don't want to embarrass them if they say no.
Sure.
But yeah.
Thanks.
Thank you. Okay, I think we're a little bit over time, a couple minutes, but I hope this has been interesting and useful. I know many of you have been waiting for information like this. So thank you for your patience. Thank you for your enthusiasm. Please come, please register, please come, please help us get these visits off the ground.
Thanks,
Okay.
Marty.
Thank you. This looks great. You guys are doing awesome.
Bye, everybody.
Bye, everyone.
How do I stop recording?
Let's see, there's a button at the end, or at the very bottom between share screen and reactions.
Yeah, I think I've got to get bigger here. Stop recording.